Measurement of the tibial plateau angle should be a fundamental part of the decision-making process when considering options for repair of dogs with cranial cruciate ligament rupture. Although there are many computer programs available to assist in measuring tibial plateau angle, it could be performed by anybody using a printout of a digital image, hard copy radiographs, a ruler, and a protractor. We will present a 4-step measurement process for measuring tibial plateau angle. Before we discuss the 4-step measurement process, we need to discuss proper radiographic positioning. Lateral radiographs are taken with both the stifle and the tarsus flexed to 90 degrees. It is also important that efforts be made to superimpose the femoral condyles on themselves. Poor patient positioning can challenge determination of appropriate landmarks, introducing undesirable variations into the tibial plateau angle measurement. Flex both the stifle and tarsus to 90 degrees and superimpose the femoral condyles. The 4 steps required to calculate the tibial plateau angle include: first, draw the functional tibial axis line between the center of the talus and the intercondylar eminences of the proximal tibia. Second, determine the medial tibial plateau line. Third, draw the reference line, which is a line perpendicular to the functional tibial axis line. And fourth, measure the tibial plateau angle, which is the angle between the medial tibial plateau line and the reference line. Let's look at this process and the landmarks a little closer, starting with the determination of the functional tibial axis line. The trochlea of the talus forms a circle, and the first point for our functional tibial axis line is the center of the talus. Moving proximally, the second point for our functional tibial axis line is the point at the center of the intercondylar eminences. There are 2 intercondylar eminences, and in cases like this example, they superimpose well over each other. Other patients do not interpose perfectly and require estimation of the center point of the 2. Drawing a line connecting these 2 points forms the functional tibial axis line. Our second line is the medial tibial plateau, which extends from the cranial aspect of the medial tibial plateau to the caudal aspect of the medial tibial plateau. Looking closer, this is the cranial aspect of the tibial plateau, and here is the caudal. Connecting these lines forms the medial tibial plateau line. Our third step is drawing the reference line, which is simply a line perpendicular at a 90-degree angle to the functional tibial axis line. Our fourth and final step is measuring the angle between the reference line and the medial tibial plateau line, and this is the tibial plateau angle. In this example, the tibial plateau angle is 28 degrees, and that's it. Measuring the tibial plateau angle of a dog is simple as these 4 steps. Determine the functional tibial axis line, determine the medial tibial plateau line, draw the reference line perpendicular to the tibial axis line, and measure the tibial plateau angle. Following these steps on well-positioned radiographs, paying attention to anatomic detail should generate reproducible tibial plateau angle measurements. Now, the morphology of every stifle is not the same, and you must become proficient identifying the points for measurement of tibial plateau angle in different knees. The center of the talus is straightforward, so we will bypass that point in these examples. Let's pick the points in this knee. We've got the center of the intercondylar eminence, the cranial tibial plateau point, the caudal tibial plateau point, the tibial axis line, the tibial plateau line, the reference line perpendicular to the tibial axis line, and the tibial plateau angle, which is easily measurable. This dog has similar morphology to our first patient. The cranial tibial plateau point is slightly less clear due to osteophytes in the region. But we've got the intercondylar eminence, the cranial tibial plateau, the caudal tibial plateau, tibial axis line, medial tibial plateau line, reference line, and the tibial plateau angle that gets measured. This is a corgi. His other knee was similar to this knee in morphology, so this is his normal. Let's look at his points. Got the intercondylar eminence, the cranial tibial plateau, the caudal tibial plateau, the tibial axis line, the medial tibial plateau line, the reference line, and tibial plateau angle. He had a pre-op tibial plateau angle of 5 degrees. Are you going to do a TPLO on this patient to repair his cruciate? Probably not. Here's a nice example of a dog with cranial translocation of the tibia from a very acute cranial cruciate ligament rupture. Picking our points, we have the intercondylar eminence, the cranial tibial plateau, the caudal tibial plateau, the tibial axis line, the medial tibial plateau line, the reference line, and tibial plateau angle. And finally, a patient with a pathologically steep tibial plateau angle. This dog likely had a growth plate injury during development leading to this slope. This dog's angle was about 44 degrees. We've got our eminence, cranial spot, caudal spot, tibial axis line, tibial plateau line, reference line, and our angle. So with a preoperative angle of 44 degrees, will it influence your surgical decision-making for repairing a torn cruciate? It should. In the end, measuring the tibial plateau angle is important. When it comes to the management of cranial cruciate ligament ruptures in dogs, there is not a single surgery that is optimal for every patient. Tibial plateau angle is one factor that influences the surgical options and should be measured by every surgeon considering operating knees in dogs.